How does a drop of IV med and blood return to the heart and out to the body? Goes through the vein, into the left atrium, into the left to the right atrium, to the right ventricle, and then out to the lungs. Then from there, the lungs send the blood back to the left atrium, back to the ventricle, and out the aorta. Up to the head, then out and down to the arms, to the abdomen, pelvis, and legs. But how? How does that work? Because believe it or not, the heart does not move blood around the body. So how does venous blood return to the heart? Movement. It's the contracting of skeletal muscles that squeeze the veins and milks the blood back to the heart millimeter by millimeter with the help of valves. As you're moving, the valve when you stop moving and the blood starts to fall back down with gravity, the valves close and holds the blood in place till you start moving again. So to move that venous blood and your IVs back to the heart, we have to have movement, 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 movement. Now, when is the only time they milk the hand? When you're starting the IV. Wrong place for milking the hand. So it needs to be after the IV is running. Well, can a patient do that for 24 hours a day, every minute of the day for 24 hours a day? No. So what happens if they're not doing it? What happens if they're just resting and fluid is going in and in and in? That's one of the causes of infiltration, which we're going to talk about later. But if they can't move every minute, and they can't, what's the other way we can do it? Well, let's get gravity working in our favor. Where does gravity take everything? Down. Well, we don't want it to go down. So how can we get the IV fluids and the bloods to return to the heart with gravity? Point up. Raise the patient's arm that has the IV in it. And it has to be between the level of the heart and the head. No higher than the head, no lower than the heart, in between. Now gravity will bring the blood and the IV fluids back to that right atrium, right ventricle, and out to where we need it to go. You never learned that in nursing school. No one ever taught that information. Radiology, laboratory medicine, or nursing, or EMS. Now that you know that, we need to change the way or the position of those IV sites are now. They need to be elevated to between the level of the heart and the level of the head. That's an easy to do when they're sitting. You can look. When they're laying flat, well, how high should it be elevated? Well, what's the distance between the heart and the head, top of the head? However many inches, divide in half. And that's how far above the heart, when they're laying, that arm should be elevated up off of the bed. New concept, I know. And you're all scratching your head or you're all poo-pooing this idea. But ask NASA, because they studied the lack of gravity effects on the human body. So they can tell you the effects of gravity on the human body. They can then apply this gravity information to the IV and confirm what I have just told you. So I'm Gail from Vein Access Technologies. That's some of the information that's missing from the academic programs and the clinical programs that train on any kind of vein access or venipuncture procedure. If you found it useful, please visit vatmethod.com. vatmethod.com and learn more.